Good evening, and thank you for joining us. Tonight, I'll be speaking, our mayor will be speaking, as well as Dr. Arwady. And we just want to continue to reinforce, some very important messages that we want parents to hear and our staff to hear. Again, as I said earlier, our schools are safe. There is no evidence that our schools have ever been unsafe this school year. Everything, when you look at cases, and I've looked at this very carefully, especially as we ended the break, cases were always at a fraction of the community. We rarely saw any significant, any instances of any major transmission. And I keep seeing statements about, all of a sudden now we're coming up with all these things today. Again, we respond to the data. We respond to where this pandemic is going. We responded to Delta, and now we're having to respond to Omicron. And I'm very grateful to all of our staff. These last 2 days have been, I know it was difficult for them during the break, and many of them feeling pressure to stay at home, to not show up to work. And I'm very, very, very appreciative of, well over 80% of our staff that came in, greeted our children, all of the students that came in, even with pressure that families were feeling to keep their children home with this just continued misinformation about schools not being safe. There is just no evidence of that. Now, what is real is cases are rising. Cases are rising, and we have said that the best solution is to do it at the school level. Our principals are empowered. Our teachers are empowered. They have safety committees. We have invested money in the filtration systems. You can literally go to our website and go look at classroom by classroom. We have indicators to tell us if we're seeing issues with filtration in any given classroom. All of our children are wearing masks. We social distance where possible. There's regular washing of hands, and we address issues at the school level. Have we had challenges? Absolutely. But at a district level, we have not seen any significant challenges. And I can't help, again, just be very frustrated and concerned that we continue to look at a district-wide, literally a district-wide walkout where, again, it's depriving our families of the choice. We had families that were nervous. They didn't come in yesterday. That's okay, because we can work with them. We can work at a school level to address any issues that might exist. So again, I want to just be clear for parents. If the CTU is successful in voting for a walkout tomorrow, because that is what they're voting for tonight, then we will have to cancel classes tomorrow. There's no way for me to be able to accept children and be responsible to our families, not just with all that uncertainty about who would even come to work tomorrow. Now, with that, to be clear, the buildings will be open. The schools will be open. We will still continue to provide essential services, and we'll have a plan, whether it's for nutrition. We still have COVID testing that's scheduled in the schools. Again, my clinics will still be open because we want families to continue to take advantage of vaccinations. So all basic services will be open. Any staff that comes into the school will be welcome to be in the school, whether it's our teachers, whether it's our custodial staff. The expectation is that staff should come into the schools, because we still have to, even if they vote to walk out, we need to have a plan for our families. We owe that to them, and I want to make sure we have a plan for them in a very timely manner. As I said, my goal is to have a plan going forward that we can communicate to parents tomorrow. With that, I'm going to ask the mayor to come
up. Good evening, everyone, and thank you all for being here. We believed it was important to speak to parents and students tonight to provide some certainty about what was going to happen tomorrow, and I appreciate all the hard work of CEO Martinez and the entire CPS team who are doing important work under very difficult circumstances. I have to tell you, it feels like Groundhog Day, that we are here again at this hour, almost 8 p.m., after everything that we've gone through over the last 2 years with the CTU leadership. Unfortunately, tonight, CTU leadership is compelling its membership to make a decision that will harm hundreds of thousands of Chicago families who rely upon CPS for their daily needs, for their education, for their nutrition, for their safety. That's real harm, and we can't overlook that. CPS has worked in good faith for over 6 months to negotiate a reasonable agreement with the CTU, meeting almost every single week with rare exception since June of last year. And we have made significant progress in those discussions in an effort to try to accommodate the union's concerns. And the bargaining table, ladies and gentlemen, is where this matter should be hashed out, the bargaining table. As you just heard from CEO Martinez, and he has done a yeoman's job in reaching out to the CTU. He personally offered to meet directly with CTU members and asked Jesse Sharkey to delay the vote so he would have an opportunity to present what the plan is to CTU membership directly and to hear from the members directly what their concerns are. The answer to that from Jesse Sharkey was no. No, I will not allow you to speak directly to my members. CEO Martinez today authorized his bargaining team to present a set of operational metrics, additional ones, to determine when classrooms or schools should be switched to remote learning to address individualized issues. As we all know, particularly now in the time of the vaccine, how individual school communities are experiencing this surge in Omicron is not universal. It is different, and the deciding factor is what is the level of vaccination on a school-by-school basis. You heard CEO Martinez and Dr. Arwady say this earlier today. We have the tool, because of the vaccine, to be very strategic, to be surgical in analyzing where we need to shift a classroom or maybe even a whole school to remote learning, because it's not experienced differently because of the vaccine. To those operational metrics that were presented today, we ask CTU leadership, take a moment, review the plan, come back to us with a response at the bargaining table, delay the vote, do not do an illegal work stoppage. And to that, the answer was no. Sorry, we're moving ahead. So we'll respond and deal with that, but I think those facts are important for parents to know. And it shouldn't be that at 8 p.m., the night before school is supposed to take place, when frankly many parents are working the overnight shift, they're going to have to scramble to make accommodations for their children tomorrow. We've seen this happen before. It happened in the strike. It happened last year when we had to fight to reopen our schools. We shouldn't be in this place again. We should be at the table. We should be bargaining in good faith. We should get to a resolution. But what we should not be doing is allowing CTU leadership to shut down an entire school system for what? We don't know how long the CTU leadership will try to stretch this work stoppage. What we were originally told it was going to be a single day of action. Now we heard later today that it's going to be through January 18th. But the fact of the matter is that we have an obligation to advocate on behalf of parents and children and be their voice at the table. And that's precisely what we have done, and that's precisely what we will continue to do. A couple of things that I think we need to remind ourselves of. In 2022, vaccines are widely available for anyone who is 5 years old or older. The answer to all of these issues, the uncertainty, the fear, is the vaccine, the vaccine, the vaccine. What I wish CTU leadership would do is join us in messaging and encouraging parents and students to get the vaccine. That is the safest way to keep everyone safe. A fully vaccinated school community is a safe community. The schools are safe, and Dr. Arwady has said that and will continue to say it. We know it because of the hundreds of millions of dollars that CPS has invested in our schools, from ventilation to HEPA filters, to partitions, to masks, to hand sanitizers, to protocols. The fact that we have safety committees at virtually every school who can raise issues of concern to a particular school community. Why are we here again? It doesn't make any practical sense. In this moment, while we are facing this surge in Omicron, We have the ability to move to individual classrooms, or if needed, individual schools to remote learning. That's what CPS has been doing all along, with great success. Rather than making a sweeping move to end in-person learning for the entire district. And let me remind you about what the consequences of moving an entire urban district to remote learning are. And we simply can't ignore the realities of the history that we experienced through 2020 and 2021. When our district was fully remote, our children suffered. There's no disputing that reality. We saw triple the amount of failures in elementary school testing and learning. Triple. And that fell most disproportionately on black and brown and poor kids across our district. Triple failure rates. More than 100,000 students were disconnected and disengaged. And I have to credit the team at CPS, and particularly under the leadership of CEO Martinez. They have done a yeoman's job to find those kids and bring them back into the system and are making real progress. Why on earth would anyone think it's a good idea to reverse that progress and harm our students again? We simply cannot ignore that sad history of what happens when we go fully remote. Having access to high-quality, in-person learning has to be an essential imperative in turning the tide of the crises that we know will follow if we send a whole district back to remote learning. We also know thousands of children never logged in to remote learning, even last year. The harms that were manifest by the significant worsening of the achievement gap cannot be ignored. And for many of them, they're still struggling to bounce back academically. I cannot stand here in good conscience as mayor of this city, as someone who has a responsibility, a solemn obligation to make sure that we do everything possible to set our children up for success, which begins with education as the great equalizer, and tell you that it makes sense to shut down an entire system. If I thought it did, if I heard that from our public health experts, I'd be the first one to tell you that's what we must do, and we would have a plan and execute that plan with fidelity. But what I know from my own experience, what I know from talking to the public health experts, what I know in talking to our CEO, is there is no basis in the data, the science, or common sense for us to shut an entire system down when we can surgically do this at a school level where needed. That is the facts, ladies and gentlemen. Now more than ever, our children need the services, the protection, and the safe and nurturing environment that we provide for them every single day in person learning. There is no substitute for that. And particularly for those kids who are challenged, our black and brown students, our low income and poor students, our homeless students, we're going to turn our back on them in a time where they need us most? No, we will not. Our charge right now is to do what we've always done, to follow the guidance of medical experts at the Chicago Department of Public Health, the Centers for Disease Control, and others, and keep our schools open for in-person learning with a robust and continued set of mitigation interventions to prevent the spread of COVID-19. Most of all, we must work together to encourage families to vaccinate every single eligible CPS student in our system. That's what we should be united against. Our common enemy, ladies and gentlemen, is the virus, the Omicron variant. That's our common enemy. And we should do everything in our power to unite together to fight that fight. We should not be politicizing the pandemic. That is a mistake and ultimately hurts our children and families. Let me also say this. We know that individual rank and file teachers love their students. We know that that's the primary motivating factor for most teachers to go into the job in the first place. They want to be with kids. They want to support and nurture them. We never lose sight of that fact, and we never will. But that's not really what this is about. It is not. And as I said before, we're not going to allow this crisis in public health to be politicized. We won't do that. We didn't let that happen from people at the national level. We're not going to let that happen here locally. We are committed to remaining at the table with CTU leadership and negotiating a fair agreement, but one that takes into consideration the voices of the tens of thousands of parents that we've heard from that said, I want my child in school. I want stability for our system. That's what we must answer. I'm not going to agree to any kind of action that takes away the choice of parents to be able to make a decision that is in the best interest of them and their children. We have an obligation to make sure we're giving voice to those parents as well. And I would urge the media, be fair in your coverage. Talk to the parents who are saying, I want my kids in school. You're always going to find folks who say, I'm afraid, I'm not going to come. And we respect and understand that. But what we're seeing in our engagement with parents is the overwhelming majority want their children in person. Nobody signs up for being a homeschooler at the last minute. We can't forget about how disruptive that remote process is to individual parents who have to work, who can't afford the luxury of staying home and being with their kids. Not because they don't love their kids, not because they don't want the best for their kids, but they need to provide a living for their families, and that means going to work. We can't forget about those parents because they are the vast majority of parents in the CPS school system. We can't forget the social and emotional trauma that so many of our students face when they were isolated and alone and cut off from their social networks. That had real profound consequences for our students, our kids. We can't forget that. This decision is about a whole set of factors, but it can't be about the politics. I reject that fundamentally. CTU, let's get back to the bargaining table. Let's do the responsible thing. Let's hammer out an agreement that sets the precedent for the nation and make sure that our schools are safe and stable for the duration. Let's not go through this again. I don't want to be up here like it's Groundhog Day. And I don't want to be in a story that's written by anybody who's talking about anything other than our kids and our parents. Now, with that, let me just say one last thing. We will not stand idly by and accept a unilateral decision at a work stoppage. We'll have more to say once we see what the outcome of the vote is and what we see what happens in the morning. But I'm urging teachers, come to school, teach your kids. Your students need you. Dr. Arwady.
Thank you, Mayor. So we've been at this for almost 2 years at this point. You're tired of it. I'm tired of it. We've had to make a lot of difficult decisions along the way. As we've learned more about COVID-19, some of those decisions have gotten easier. One that is the most clear is around schools. Do you know what the maxim is that public health leaders share when we talk to each other? Schools, first to open, last to close. That's what we talk about when we talk about our plans, our worst case scenarios when we are thinking about COVID surges. And make no mistake, we are in a COVID surge right now. I'm concerned. We have a lot of people in the hospital. You know who's in the hospital? As I've said over and over again, that surge is being driven by people who are not vaccinated. But when I think about a city that is open right now, in what world would we think to close something essential like in-person education when we have seen the negative effects of that when our bars remain open? No public health leaders in the world at this point think that that makes sense. I'm hoping we won't need to get to a point where we make those larger societal closures. It's the last place we want to go. But let me tell you, the science says schools would be the last place to close in that setting. Europe is in an Omicron surge right now. You know what? Their schools are open. Across the country, there are many places with higher positivities, including New York City. Their schools are open. We saw, even before vaccine was available, that when students and staff were in school, their risk of COVID was actually lower than when they were out of school. Why is that? That wouldn't be what you would necessarily expect. But what we saw, again, replicated multiple times, where does COVID take advantage of us? When we let our guard down. In school settings, where not just CPS, but all of our Chicago schools have worked really hard to put those layers of mitigation in place. I knew a year ago that it was going to be a hard sell. I'd seen the data. I'd seen right here in Chicago last fall when CPS was remote and many of our private schools, including the Archdiocese, were in person. We did that study. We compared that data. And do you know what we saw? Lower rates of COVID-19 in both staff and students that were in school as opposed to those that were out of school. So yes, it's a surge. Yes, it's appropriate to have schools, for operational reasons, need to go on to remote, but we've only gotten safer since then with vaccination in place. I shared data today. Kids, even before the vaccine, about as likely to get hospitalized with COVID-19 as they are from influenza. I compared that to flu data over the last 2 years. And with vaccination on top of it, that risk goes lower. We have 550,000 children in the city of Chicago. We're averaging 7 hospitalizations a day, virtually all of them in unvaccinated 12 to 17-year-olds. We've not had a single vaccinated 5 to 11-year-old admitted to the hospital, and the few cases where we have seen breakthrough hospitalizations in kids are in kids who have significant underlying conditions and have already been offered the opportunity to have remote learning. I know staff are worried. I shared data today. If we look at working age adults, 30 to 64, 35 times more likely to be hospitalized with COVID right now if you are unvaccinated compared to being vaccinated or boosted in the city. I'm so glad that I can tell you, if you're vaccinated, especially if you add boosters on top of that, you're in that working age group. Unless you already have a significant underlying condition, and again, there were things in place for that, your chance of getting seriously ill is low. For all of these reasons, and for the fact we think about the health in all forms when we think about kids in school, I'm disappointed that we're having this conversation again, because this is one that has been answered. I make a lot of hard decisions. I give a lot of advice. You look at the data on this one, the answer actually is very clear. And with that, I will hand it back over to the mayor.
Obviously, we will take your questions. Cesar?
Thanks a lot, Mayor. Members of the media, thanks so much for being here tonight. As always, 2 questions per reporter. Silvia Barragan will pass down the mic, and just a big favor, can you just keep your mask on while speaking? Thanks, guys. Nader Isa from Sun-Times.
Yeah, let us know who your question's for. Yep.
All right. So we asked CEO Martinez yesterday if you can weigh in earlier today, actually, about just moving forward. We know classes are canceled tomorrow. There were questions about remote learning. Will that happen if CTU stays out Thursday, Friday next week? The district spent almost $40 million on 100,000 laptops just a few weeks ago. So are there any plans to distribute those and move to remote learning, or is this going to be a closure for however long the CTU stays out?
Well, the CTU doesn't make decisions about how our CPS system works. The CEO does. He's the boss. He's the employer. So I want to be very clear about that. I think I'll let the CEO Martinez speak for himself, but I think we have to be very clear about what happens tomorrow. And we'll have to see what tomorrow brings. My hope is, despite all the pressure and despite what may be an affirmative vote, the teachers are going to show up tomorrow. And that's certainly my expectation. Pedro.
Thank you, Mayor. I mean, first of all, the number one thing that I want parents to hear is that the schools are going to be open. And so what we want to, of course, we'll see the results tonight. I have to cancel classes tomorrow for sure because, again, I have to be responsible in receiving children. I'm going to be working with our principals. I'm going to welcome every teacher that comes into our buildings, and we're going to have conversations because we need to have a conversation, and we have to, and the question I'm going to be asking is, how do we make sure we move forward with a responsible plan for our parents? Because it's not about CTU, it's not about the political environment here, it's about how are we going to be responsible for parents. The main question that I think all of us are struggling with is there's not a trust level. And that groundwork was laid, well before I got here. There's not a trust level. There is so much misinformation. So how can I guarantee parents that this is a pause and not something much longer, that there isn't another agenda behind it? That's our biggest question. Because we, as the mayor said, Dr. Arwady said, I've seen it firsthand, both here and in my former district, remote learning is not going to help our children. We have to be accountable to our families of how we're going to prepare them academically. That is our mission. That is our core work. And so the conversation I'm going to have with my team tomorrow is how do we ensure that? How do we move forward? And frankly, and we're going to, well, I'll leave it at that. I mean, that's the main thing. But we want to respond to parents tomorrow because I don't want parents waiting to see what's going to happen. Of course, we're going to see what the vote is tonight.
But are you considering anything with the laptops you've bought? Any types of plans?
I don't want to speculate because, again, for me, I mean, sadly, we shouldn't even be having this conversation tonight. In what world would imagine somebody coming to you and saying, we're going to make a decision about your children being able to school tomorrow at 9 o'clock tonight for tomorrow? I mean, in what world do we live in where that's okay? And so, again, I have to respond, again, to what happens. And so, therefore, again, tomorrow, I'll be meeting with my team. We're going to work on a plan. And then I'll work with my board, I'll work with the mayor, and then we're going to communicate it to parents. But I don't want to speculate. I want to see what the results are tonight. I want to see who shows up to work tomorrow.
And for my second question, you mentioned CEO Martinez earlier today about the anxiety, the testing program you wanted to put together to alleviate some anxiety for families. Do you think you, the district mayor, you've played any role in what's going on right now? If parents see the failed testing program over winter break, anything like that, do you think you have any role, or is this entirely out of your control?
Well, again, let's be clear. Would I love to have testing for every single student, every staff, every week? Absolutely. But when you look at the fact that even with limited testing last semester, did we see significant outbreaks in schools? Did we see, hundreds of thousands of children going remote? Did we see tens of thousands of staff getting COVID? I mean, did we see that? I mean, we have to ask those questions. And that was a basic, in a very minimal, I mean, we built our capacity to test now. We did 10,000 tests yesterday at 125 schools. We are now testing in every single school. I still want to do more. I am not going to give up on that. That is something that I think I need to continue we'll continue to advocate. We're going to be talking to the governor. We're going to be talking, we're going to put pressure on the federal government. But the test itself is not the determining factor, folks. It is not. And again, the better question to ask, have we run out of a vaccine supply in the city? Have we? Because that's the only solution here. Now, if that was going on and we have somehow played a role in that, hey, I'm responsible then. Hey, hold me accountable for that. A test should not be the determining factor for this. Because, again, we have to follow the science. We have to follow the data.
Charlie Demar from CBS 2.
CEO Martinez, if the rank and file does vote to stay out of the classroom tomorrow, what are the consequences for not showing up to work?
I mean, the simple answer is if people want to be compensated, they have to show up for work.
So teachers won't get paid?
If you want to be compensated, you have to show up for work. It really is that simple. And folks, and in fact, let me say this. Even remote days at a district level don't count towards our requirements for the state. They do not count. So there's also the challenge of, depending on how long this goes, whether it's remote or canceling classes, I have to have a plan for making up days. Because remote days at a district level, the way it's being done tonight, if they're successful, do not count towards our academic requirements for the state. I want to make that clear. They do not count. We are not authorized to just make a decision to go remote. Even if the mayor said, "I want you to go remote, Pedro. I don't feel it's safe right now. I want you to go remote." We are not authorized. My board cannot authorize it. The only way that can be authorized is through an emergency action from either the governor or the Department of Health, who says it is just too unsafe. We have to shut down the entire city. That is the only way that we can do remote. So I just want to be clear. Anything we're doing, again, is not going to count towards our academic attainment. And so, again, that's a challenge that we're going to be researching tomorrow as well, because, again, we shouldn't be in this situation at this time of night as we're trying to, again, we should be working this out and understanding all the challenges.
It's clear that classes are canceled tomorrow, and I get that this is fluid and you're getting information in real time. Any information for parents about Thursday, what to expect?
We will have a plan, again, that we will be working on tomorrow to communicate to parents, because I don't want parents to be, again, we want them to understand at least what we're thinking for the rest of the week. We will do that tomorrow.
Oh, Eric from ABC7.
I'm sorry, just to be clear, our class is canceled tomorrow. Are you preemptively canceling classes tomorrow?
No.
And if you are not, at 8:25 p.m., why not preemptively cancel? Because there's a lot of parents out there who want that certainty at 8:25.
Yeah, no. Again, we have to. It's based on the vote, because let's say our teachers say no. We agree that our children need to be in person. The science is clear. Yes, are there things that we can improve, especially at the school level? Because again, it varies school by school what some challenges are. If they vote no, our children need to be in person. Classes are on. Classes are on. If they vote that they're going to do a walkout, that they're going to actually not show up for work tomorrow to teach children in person, the only responsible thing I can do after that vote is to officially cancel classes.
But Mayor, you're saying that you're hoping teachers, even if there's a vote tonight, to go remote, that they will still show up for class tomorrow. So, I mean, should students show up tomorrow? Even if this vote goes the other way?
I think we've been very clear. If there is an affirmative vote to walk out on an illegal work action tomorrow, classes tomorrow are canceled. I think we've been very clear about that. There's no ambiguity there. But yes, of course, we believe that teachers should come to work. If they want to be paid and compensated, they've actually got to come to work and do that. If they do not, they will be in a no-pay status. Now, obviously, we want to provide very clear, predictability to parents and students, and we will see what happens tomorrow. As the CEO said, our responsibility of parents is to make sure that we can function operationally. There's no public health reason to shut the entire system down. None. You heard that very definitively from Dr. Arwady, who's been saying this consistently day after day. We're not going to abandon the science. We've come too far. We've learned a lot. We have the vaccine. Our schools are safe. We've invested into safety. We will continue to do so. And we're not going to abandon that and politicize the pandemic. That's not going to happen. So my hope is that teachers will show up tomorrow, that we can reassure parents that we have the resources in place to be able to continue in-person learning. So we're not going to speculate about what will happen tomorrow, because we're not there yet. We're not going to speculate about what will happen at the end of the week. We've been very clear, though. If there is an affirmative vote by the CTU leadership, who will be choosing to take the choice out of the hands of parents, then we have no choice but to cancel classes tomorrow. But the expectation is every single member of the school community will show up tomorrow and report for duty, because that's what their obligation is to our parents and our students.
And just to be clear, if classes have to be canceled tomorrow, students should not show up because CEO Martinez mentioned something about a nutrition plan, or is he talking about perhaps
Look, the practical reality is, given who our school population is, members of that community depend upon the schools for 3 meals a day. They depend upon the school for health care. That's why in the face of no science that tells us that an entire system should shut down. We don't agree with that. We don't agree with the CTU leadership urging its membership to take this kind of unilateral action. So we will be there for our parents one way and the students one way or another.
All right, front and center with Enrique Rodriguez from Univision.
Thank you, Cesar.
Hello again.
Mayor. Hello, Dr. Arwady. My first question is going to be for President Martinez, and if you don't mind, I'm going to ask it in Spanish. Presidente Martínez, yo sé que usted no quiere especular, pero usted mismo ha dicho que nuestros padres están pasando por mucha ansiedad y hay muchos de ellos que no pueden esperar hasta mañana para organizarse. Con eso en mente y ante la gran posibilidad de que haya una opción del sindicato de irse a educación virtual por 2 semanas, ¿cuál es el plan y cómo pueden estar seguros padres de familia de que sus hijos van a tener el equipo adecuado para estar estas 2 semanas desde casa?
Sí, no. Bueno, primero, las reglas de lo que está pasando ahora en la noche no son nuestras reglas, ¿verdad? Tomando la decisión para dar un voto para nuestros maestros, para no regresar a nuestros salones, para estar con nuestros niños en persona, eso es algo que el CTU ha decidido. Ellos solos, ahorita están votando hasta las 9 de la noche. Nunca ha habido una conversación con nosotros, como lo que yo he pedido del CTU, que no tengan ese voto ahora, que mejor trabajen con nosotros para que podamos trabajar juntos para tener las escuelas abiertas y a ver cómo podemos arreglar las diferencias que tenemos, ¿verdad? Lo que yo quiero para nuestros padres, que sepan que no tengo una opción, que tengo que cancelar las clases mañana porque no voy a tener los maestros para cuidar a los niños. Lo que vamos a hacer mañana, pero todos los empleados van a tener, si quieren que se paguen por el día, van a tener que llegar a trabajar en las escuelas. Lo que vamos a hacer es trabajando para hacer un plan. ¿Qué va a pasar? Para tener un plan que los padres sepan, esto es lo que vamos a hacer el jueves, el viernes y esta semana que viene. Y eso, y no quiero ahorita especular porque no sabemos, todavía no sabemos los resultados del voto todavía.
Okay, gracias. Mayor, question for you. How far in advance was the proposal presented to CTU?
Well, look, we've been at the table with CTU every week. We even met the bargaining team from CPS, even met with them over the holidays. So this is the first week back. We were responding to concerns that they had raised. We put together, CPS put together an operational plan, and we asked them, actually review the plan and then get back to us. Do not take this unilateral action until you've had time to review the plan. It was sent over, this morning? Plenty of time for them to evaluate it. If there was a sense of urgency about getting something done, plenty of time.
Because we heard some comments about them not getting enough time to analyze the plan.
Well, if they don't have enough time to analyze the plan, the answer shouldn't be, let's blow up the whole system and shut it down. The answer should be, take the time necessary to respond and analyze it and continue working at the bargaining table. That's what responsible leadership would do.
All right, Aaron from the Hyde Park.
Hi, 2 for Dr. Arwady, please. I wondered if you could talk more about the CDC science brief on transmission of SARS-CoV-2 in K-12 schools that you referenced earlier today. All of the evidence there, well, it's dated on January 15th, which is obviously before Omicron became dominant in the United States, right?
The most updated data is actually, I think, from December 17th, so I don't know if we're looking
I'm sorry. It's
okay.
dated, actually, you're right. Yeah, there's 2 different dates on it. I'm just wondering.
No, Dr. Arwady is right about something.
Excuse me. Yeah. Anyway, I'm just wondering, given the really high transmissibility of Omicron and a lot of that data being from last year, it's accumulated over time. Can we be sure that the data can be applied to the current situation in classrooms and that kind of stuff?
Yeah. So good question. This is where we've been putting a lot of attention on what we've seen really since Omicron has been in the world. And so we looked at the data in South Africa, including related to schools. We've looked at the data in the UK, in Europe, and we've been looking to see what the data looks like here. We've not seen any differences in terms of how Omicron is presenting compared to Delta when we look at severity. So the fact that it's still 5 times as likely likely that someone will be hospitalized if they are unvaccinated versus fully vaccinated, and 9 times it's actually more likely compared to the Omicron data. So is it more transmissible? It is. Is the severity greater? We've seen absolutely no evidence of that. And is there any evidence that schools themselves serve as the point of transmission more? No, there's not. And so we're in a surge, yes. But what we've seen over and over again is that, again, what have we seen? Cases in kids rise over break while we're out of school. People who think that the school is what is driving it, and I know this is hard for folks to understand, that's not what we see. We see it reflect what's in community.
Sorry, and I didn't mean to mansplain earlier.
It's okay.
Yeah. And additionally, and I know Twitter is not real life, there was a lot of controversy earlier online after you suggested that people buy tests online over Amazon. I know we're just weeks away, hopefully, from the federal government having 500 million tests that people can order from a website. But, does the city have any tests that are available for, people to hand out? I know that some aldermanic offices have had tests. But time and money is really valuable to poor people, and, they can't go to...
Trust me. Here's the challenge. When there was a decision made to ramp up rapid testing availability at the federal level, which, by the way, I'm in support of. The concern was this was done in such a way that it completely dried up the supply of rapid tests here on the ground. So the Chicago Department of Public Health, all along, we have been spending a very large amount of money, much of which is reimbursable from the feds, and getting rapid tests, and have been deploying them into the communities where they're most needed, using them in our high-risk settings, using them as part of investigation and contact tracing, supporting schools, et cetera. Our orders, going back to November, have gone unfilled, and we pushed our last rapid tests into our homeless shelters last week. CDPH has no rapid tests available. I was just on a national call. That is broadly the situation across the country. Yes, we're hearing within a couple of weeks this should be ramped up at the federal level, and we've been asking a lot of directions of whether there's the ability to get additional rapid tests. But honestly, they are not available because of supply chain issues right now.
Sarah Karp, WBEZ.
My first question is just a yes or no question that some parents are asking me. Can they drop their child off tomorrow at their school for childcare if they need it? Yes or no?
Yeah, classes will be canceled. We will have administrators. We're going to have teachers there, and so again, we will serve any child that comes in, and really make sure they're cared for. But I just want parents to know we are canceling classes across the entire district if this vote goes in the affirmative that they're going to do a walkout.
My second question is, when did...
Who is it to?
This is my second
Who's
one.
the question to?
Oh, maybe Mr. Martinez, but it could be for either of you. I was just wondering at what point there was a decision that the school district would come to a safety agreement with CTU, because it seems to me that since June, while there might have been discussions, there was sort of an idea that since the governor didn't have an emergency order, that there didn't need to be a safety agreement.
I'm sorry, ask that again?
So, there hasn't been a safety agreement in place this school year, and I'm wondering, when did you guys decide that you actually needed to come to a safety agreement with CTU? Because I think that while you've been bargaining, there hasn't actually been any real proposals on the table or any real idea that there would be an agreement.
That's just simply not correct. That's
So
just
you guys
simply,
have been...
No, that's just simply not correct. The CPS bargaining team has been at the table in good faith, putting proposal after proposal on the table to try to respond to the issues that have been articulated and raised by the CTU leadership. So it's simply not correct to say that there hasn't been a proposal. We've always been open to get a proposal done. We wanted to get a proposal done before school started. Before school started. Not during school, not having a return to Groundhog Day over and over again. This is not fair to parents. It destabilizes the system. So we've been at the table in good faith every week trying to get a deal done. Now, you have to ask the CTU why they haven't been able to close the gap and meet us halfway on a range of different issues. And I'm not going to get into the specifics of what's on the table, but we're seeing the same thing over and over again. A complete moving of the goalposts over and over and over again. There's a deal to be had if there was an interest in getting a deal done. You know, somebody asked me the question, oh, we heard from them that they hadn't had enough time to review the latest proposal. Then take the time. Take the time. But you don't do that and say you want a deal by blowing up the entire system and shutting it down. Right? You don't do that. That's politicizing a pandemic when people are scared, when people are nervous, and filling the atmosphere with a lot of half-truths and misinformation that only serve to scare parents, scare students, and don't tell the truth about what's actually happening on the ground in real life in our schools. It doesn't tell the story of what CEO Martinez and his team have been doing diligently every single day, every single week, looking at the data, making sure that we can operate safely, and where we need to go to remote for a short period of time, doing just that, at a classroom level, at a school level. As I said before, people across the city and the school community are experiencing this surge differently. And it's really being driven by what the vaccination rates are. So if we really wanted to move the needle and get our school community to a different place, what CTU would do is link arms with us and promote vaccinations. That's what they would do on a school-by-school basis. They would use all their social media and other resources that they have at the ready to do a work stoppage. They would turn that for good to do an action to get our kids vaccinated. That's what they would do. So I don't want to hear that we don't have a plan, that we haven't put forth a proposal. We put forth multiple proposals. But if you got it takes two to tango, and you can't keep moving the goalposts. If you do that, yeah, you're never going to get a deal done. And you're going to whip up a whole lot of controversy, a whole lot of chaos. But meanwhile, you're not really serving the interest of who we should be looking forward, who we should be putting forth is our parents and our students. That has to be first and foremost in all of our minds. I can't even count the number of times that I've stood behind this podium or one at CPS and said exactly the same thing over and over again. It is like Groundhog Day. We've got to take care of our parents and our kids and put their interests first, and I'm not going to let anybody snatch control of this system away from our primary stakeholders, who are our students and our parents.
Thank you, Mayor. Thank you. That's a wrap.
I think she's got one more.
One more?
She's entitled to one more.
So if you guys knew that a safety agreement and agree that a safety agreement needed to be in place, and one's not, why not revert back to the last safety agreement that expired this spring?
Because the last safety agreement was in a world where we didn't have vaccines. There are some pieces of it that remain relevant, like the safety committees, which we think were a good idea and was a proposal by CTU. But the world has changed dramatically, even since last spring, particularly because last spring I think we maybe had vaccinations for older kids, but now we have it from 5 to 11. And soon we're going to have vaccines for even younger kids going to 6 months. So the world has changed. We need to adapt to it. But look, we're willing and open to remain at the table. It's not us who pulled away.
Thanks a lot, Mayor. That's a wrap, everyone. Have a good night.
Mayor, just about 9 hours ago.
You've been listening in on a press conference with Chicago Mayor Lori Lightfoot and the CPS CEO Pedro Martinez, Dr. Allison Arwady there as well, recapping a lot of what they've been saying about their stance on closing the schools in classroom learning if this vote from the teachers union does come into effect and they decide that they will not be coming in tomorrow. One key additional piece of information that we learned is that if the teachers do not come in, they're basically terming a walkout. The CPS CEO Pedro Martinez said that they consider it a walkout, and if you don't show up, you will not be paid. Now, we're still waiting, as that vote is still in the process, to find out if, in fact, the teachers will vote to go to what they call remote learning and not coming into school tomorrow. We will keep you updated. We'll have much more here on CBSN and on our live newscast coming up at 10 o'clock.